everyone, my name is Miriam Demirci and I want to talk about acidosis today. The human body has a pH range between 7.35 to 7.45. If the pH is above that number, it's basic, and if the pH is below that number, it's acidic. The acidosis means the pH is more acidic. During acidosis, blood becomes more and more acidic. It means the pH is dropping below 7.35 because the kidney is not giving enough bicarbonate or the lungs are holding too much CO2. This is the acid-base equation, which here we can see hydrogen ion, and here is bicarbonate and water and CO2. During acidosis, usually bicarbonate will decrease and hydrogen ion will increase, which this causes metabolic acidosis. But when we see increase in CO2, which is here, this causes of respiratory acidosis. The kidney mostly control your bicarbonate level and your ventilation control your CO2 level. But what is metabolic acidosis and what is respiratory acidosis? During metabolic acidosis, the kidney is supposed to give more and more bicarbonate to change the pH value to the normal range. But during acidosis, the kidney doesn't work well to give enough bicarbonate to balance out the pH. So it will cause the metabolic acidosis. And metabolic acidosis, most cause of kidney diseases, severe diarrhea, diabetes, and acute kidney injuries. Respiratory acidosis. The lungs bring more oxygen and let out CO2 as you breathe, but during respiratory acidosis, lungs don't let out enough CO2. So CO2 build up in the blood and cause the blood to be more acidic. Because CO2 is an acid, a patient with respiratory acidosis has a decrease in gas exchange in the lungs or a decrease in the respiratory rate, which usually respiratory acidosis cause asthma, bronchitis, COPD, and pneumonia. But how does the doctors diagnose acidosis? The doctors usually use an anion gap test, which is CMP and BMP test, which CMP is complete metabolic panel and BMP is basic metabolic panel. These two check your kidney function. They will usually check your CO2, calcium level, protein, blood glucose, and electrolyte level. And the second one, they might do the blood gas test, which measure the pH of your blood and the level of your oxygen and CO2. So if a patient diagnosed with a respiratory acidosis, the doctor will want to check the health of the lungs, which usually is by do a chest x-ray. But if a patient diagnosed with metabolic acidosis, doctors usually order a urine sample to check the pH. Treatment. As of all acidosis, so doctors usually use oral sodium bicarbonate, or they use the IV, or they do sodium citrate or oxygen, or they put the patient in the oxygen. But each of these, it depends on if the patient have metabolic acidosis or respiratory acidosis. So doctor can make decision which one are the better treatment for the patient. And this is my reference. Thanks for joining me today.